Hello, congratulations and welcome to UC San Diego Health. I am here with the Office of Compliance and Privacy to inform you of who we are and what we do for the health system. Here at the University of California, San Diego, we have a commitment to the highest ethical, legal, and professional standards. Compliance is here to help you comply with those legal requirements as well as understand the different rules, regulations, and policies here at UC San Diego Health. We realize that we hold the university in trust for the people of the state of California. At the core of what we do is a commitment to serve patients. Compliance is here to help you better serve those patients by understanding the different healthcare rules and regulations, all while upholding the integrity and reputation of UCSD. UC San Diego Health has strict rules related to government funding. An example of those rules is the privacy and confidentiality rules that protect patients and research data. It is important that we understand and follow the different government regulations so that we are compliant and able to receive government funding. Within the compliance department, we educate the community so that everyone is aware of the different policies, rules, and regulations. We empower everyone so that individuals feel that they can detect compliance issues and bring those issues forth. We also establish mechanisms so individuals know how and where to report issues. If you see something, we want you to say something. If you do see something and you want to say something, there are several different ways to do so. The first is called iReport. iReport is located on your main desktop and is a yellow smiley face icon. iReport is a system that will ask you prompting questions such as what happened, where did it happen, when and who was involved. This system will ask questions that we need to know. If you prefer to remain anonymous, there's also the whistleblower hotline, which is protected by a UC non-retaliation policy. The hotline is completely anonymous, so if you submit a report, please make sure to include as much information as possible, since we will not be able to get back to you and ask clarifying questions. Additionally, if you have any general questions or want to report an incident directly, you can contact compliance at the main compliance phone line or email address. Health Insurance Portability and Accountability Act, also known as HIPAA, was established in 1996 and tells us how to protect our patients' information. This act is a set of safeguards that help prevent any unauthorized access or disclosure to protect health information. Protected health information is also known as PHI. Protected health information is any personal or health information UCSD creates or maintains in the course of providing treatment, obtaining payment for services, or while engaged in healthcare operations, including teaching and research activities. If you would like to see a complete list of the 18 different PHI identifiers, please visit the link provided. PHI includes identifiers such as name, date of birth, and address. PHI includes other less commonly known identifiers, such as appointment date, facility name, provider name, or date of birth or death. Even if you do not use PHI yourself, you will want to become familiar with the list, especially the ones your department is working with. While working with HIPAA, we always want to use the minimum necessary to accomplish our tasks when doing our work. Ask yourself, do I need this information to do my job? In order to protect information and keep it safe, it's always best to use the least amount of information needed to accomplish your work. This can help prevent any unauthorized disclosures that might occur. Failure to comply with HIPAA may result in disciplinary action up to and including termination of employment. Now, this is not meant to scare you, but we want you to understand that we take patient privacy very seriously, and we expect that you do the same. UC San Diego Health utilizes a monitoring system called Fair Warning. So consider this your fair warning. Fair Warning monitors the access in our electronic health records and detects if individuals accessing appropriate information. The system will notify us if unauthorized access is detected and we are able to see the exact information that the user accessed. So please keep in mind that we do have extra eyes on electronic health records. Remember, always stay within your work scope. The Office of Compliance and Privacy has 3 main programs. The first is the Privacy Program. Here at UC San Diego Health, we take patient privacy very seriously, and the Privacy Program has several different ways to protect patient privacy. Break the Glass adds an additional layer of protection onto a patient's medical chart. We also help with Business Associate Agreements, also known as BAAs, which are contracts with outside vendors who handle UC San Diego Health PHI. These contracts outline the requirements to handle our PHI. We do exclusion screenings as well as medical identity theft inquiries. We also come out and provide privacy or HIPAA training if your department is interested in learning more. If you have any general questions or concerns, please reach out to our privacy team for more information. All right, so let's go over a scenario next. Becky was told by her coworker that her boyfriend has a sexually transmitted disease. Becky is concerned about her health and decides she is going to look up her boyfriend's medical record to verify the rumor. What should Becky do? Should she A, go ahead and look at her boyfriend's medical record because it involves her health? B, ask her coworker to look up her boyfriend's medical record and verify the rumor? Or C, it is not okay. Becky can only look at a record when providing direct treatment, payment, or other authorized operations. The correct answer is C. Under no circumstance should Becky access her boyfriend's medical records. Becky should only look up information pertaining to her patients and workflow. Let's go over another scenario. Becky saw an interesting stab wound while providing treatment. She decides that her social media followers would be interested in seeing the images of the patient's wound. She goes ahead and posts the picture on her social media page. What are the privacy concerns? Is it A, Becky violated Medical Center Policy 523.1 regarding social media? B, Becky violated the patient's privacy and confidentiality? C, Becky could be interfering with a police investigation by posting online? Or D, all of the above? The correct answer is D, all of the above. All of these things are privacy concerns. Our next program in the Office of Compliance and Privacy is Billing and Coding Services. Documentation is very important, and we want to ensure you are correctly documenting the services that are provided and not submitting any false claims. Our billing and coding team is very knowledgeable and can provide any education and guidance on documentation. They can also answer any questions related to clinical research, hospital facilities, or professional billing and coding, or general billing compliance questions. In our next scenario, Dr. Becky saw a patient in consultation for an abscess of the right finger. Dr. Becky performs an incision and drainage, however, does not document the procedure. She submits a claim for the procedure. Is this considered a billable encounter? Is it A, yes, because she performed the procedure, or B, no, because the procedure was not documented? The correct answer is B. You must document all services before submitting a claim. We look for and can see false claims, and this could result in penalization. The last program we have is our Research Compliance Program. UC San Diego Health has a very large and robust research program. Our research team focuses on human subject research, and compliance can assist you with external audits or general questions or concerns. This group also conducts routine for-cause regulatory reviews to ensure compliance. On to our last scenario. Becky works as an administrator at UC San Diego Health. A clinical trial participant arrives for a research visit. Becky notices that the patient does not have a signed consent form and HIPAA authorization in Epic for this clinical trial. What are the research concerns? A, there are no research concerns. B, per MCP 340.1, all UC San Diego Health staff have the responsibility to verify that an informed consent and HIPAA authorizations have been obtained from the subject prior to carrying out or participating in research activities. C, Becky should complete her work and upload the forms at a later time. Or D, Becky should turn the participant away. The answer is B. Remember, you must have all completed forms before the subject can participate. We want to ensure our participants are protected. MCP 340.1 outlines the exact steps and protocols for this exact situation. UC San Diego Health has over 300 policies broken up into series from 100 to 900. These policies are specific to UC San Diego Health. You can search for these policies by typing in the policy number or name. You can also put a keyword in the keyword or phrase box, and all associating policies will pop up. For example, if you see a patient videotaping staff and other patients while in the hospital and you are not sure if this is okay, you can type in videography as a keyword. All associated videography policies will pop up, and you can review where UC San Diego Health stands on the issue. You can review all of UC San Diego Health's policies by visiting this link on the screen. Please let us be a resource for you. We can help you if you have any questions or concerns. We are here to help. You can contact us by calling our main compliance and privacy line, emailing us, or visiting the Pulse website for any additional information. Thank you and welcome to UC San Diego Health.